So here's the thing. I could be anyone. Don't ever believe anyone just because they're on YouTube. Especially when they're saying stuff about what you should spend your money on. Please do your own research. Of course, I feel what I'm saying is unbiased, and I hope you get some value from it. But don't just blindly follow the advice of me. I'm not an expert, I just like crypto. And the internet's basically made a whole bunch of things easier, like ordering taxis, which that guy seems pretty happy about. Oh, he's the driver, he's delighted, that's why he's happy. The guy at the back's just like, yeah, just drive. Ordering airplanes like the one that's just flown overhead. Can you believe I'm in a shed right now? Buying books. Cheapest mystery gift box. What even is that? I've just typed random stuff into eBay and there is literally someone there who will sell you 500 quid worth of random stuff. And it's even easier to go on holiday and take your random stuff with you. So it's easier to find what you want and even to know if it's going to be any good because people leave feedback nowadays. You can like this video or dislike it or, I don't know, lots of people liking stuff. And it's also easy to pay for it. Blockchain link. So let's just take Airbnb as an example. Airbnb took a sector which had lots of difficult to access parts with high payment friction, and they basically packed them all into a single marketplace. And they're now the world's largest accommodation provider. And they don't own any real estate. And you can access all of that with just an internet connection. Like mine! Either got BO or chroma key issues. And the internet can also provide information about any one of a number of ailments you may be suffering. But what about if you need a professional's opinion? Now, in the UK and many other countries in the world, we have a health service which is free at the point of treatment. And you can even pick up the phone for health advice from someone who's trained. But not every country in the world has a service like that. Not yet! Joking aside, medical services can be extremely expensive in many parts of the world. Relatively speaking, I mean, £16 for me to go and get a dental appointment is, you know, it's nothing. But £16 for someone from another part of the world is going to be a massive, massive outlay. And imagine if for whatever reason I had to travel without public transport or a car a few days to see a professional whilst feeling unwell. And to boot, what if you had to go to a neighbouring country to see a specialist and had to wait for, say, a cross-border payment which had stopped or delayed? And then you get there and find there's been some kind of emergency and that they haven't received your records, the health insurance company hasn't paid out, and you left the paperwork at home anyway. And when you've got all that sorted, you've only got a limited amount of time with this medical professional to diagnose you anyway, because that's all you can afford, and you struggle to understand each other anyhow, because you're talking a different language. The above reasons, excessive bureaucracy associated with international travel, or even just regional travel in some cases. Patients might only get a few minutes with a specialist, which makes accurate diagnosis and treatment really, really hard. Now, Airbnb revolutionized travel. Well, is a company that's been around for a few years who is now utilizing blockchain to revolutionize healthcare. And I think this is a really, really interesting application of blockchain technology. It removes barriers by connecting patients in any country to medical specialists in any country via global telemedicine and local concierge services, who are all able to provide medical support to patients in their own language. Like I say, Well's a few years old and they started in April 2015. And what's impressive about them is that they're not just a random country who are like, hey, we're medical. They're actually Medicare certified as the US federal health insurance system. And they already work with multiple healthcare related clients, dozens of hospitals and over 200 healthcare agencies. And the idea is that their platform is going to allow access to healthcare services 24 hours a day, 365 days a year, wherever you are. Hospitals are great places if you want to go to catch a disease. Partly because that's where sick people go, but partly also because you're there for quite a long time. The waiting times are huge, even just for A&E. It aims to reduce some of the burden on hospitals. And in addition to that, it's a low-cost business model which could reduce medical prices by up to 30%. And that's going to be a big deal to people from low-income regions of the world. World Token is going to allow users to send and receive payment in minutes. We all know that blockchain's good at that. And this eliminates the risk of non-payment for professionals. It also means that if you are making cross-border payments, lower fees. They already introduced last year a demo version of their telemedicine platform. And right now it's servicing multiple healthcare organizations in the United States. And it's provided over 20,000 telemedicine sessions. So we're not just talking about something that's pie in the sky. This is actually happening. The key features and capabilities of the platform include remote monitoring, connectivity with patient devices, video and conferencing capabilities, and integration with various electronic health record systems. There are currently 8 members on the team and a bunch of advisors, basically combining a load of healthcare experiences with blockchain. One particular advisor that I find quite interesting is Brian Hansen, who's also worked on Ancestry.com, and they deal with hundreds of thousands of records, so Just saying. Now, what's the use case for blockchain here? Well, first things first, blockchain is being applied to remove even more payment friction. Similar to BNB, well, is also allowing kind of the ranking and rating of different healthcare professionals around the world by directly connecting healthcare specialists to patients worldwide, including ranking, scheduling, payment, and providing access, like I said, to a whole network of providers. Now, in terms of why I think this is going to be successful, telehealth is a big deal. Like I said earlier, we use it in the UK. The NHS has their hotline, people are encouraged to use, and primary care is shifting more and more towards telehealth. Because it just makes sense. We have limited resources, growing populations, cut down on travel time, cut down on people being physically in hospitals if they don't need to be. It's a great idea. It's estimated, and I've got the figures here, it's estimated that the global telehealth market may reach 113 billion by 2025. That's about 18.3% compound annual growth rate. Try saying that when you first wake up. The Well ICO is currently ongoing until it reaches a hard cap of 28 million. There's a total supply of 1.5 billion Well tokens, 40% of which, that's 600 million, are available in the crowd sale. One Well token's equal to $0.1 US. And this gives Well a market cap of about $60 million. There's currently an 18% bonus, so £1,000 investment is gonna equal 11,800 tokens, which means the price is about 0.085 cents. Now, at the moment, Dentacoin is a top performer in the coin market cap top 100, and that's another medical coin. And if that's anything to go by, Well could well increase in value by at least a factor of 4. Well, are currently under negotiations with a few different exchanges, and they're going to announce them before the end of the crowd sale. At the moment, though, the only ones they've got are Xena LA token and Cobbin Hood. Cobbin Hood, riding through the glens. A minimum investment of $1,000 US, and there are restrictions in the US, China, and Singapore. And so just a little bit more on the use case now. Because blockchain is going to make pre-authorization faster, patients are more likely to get treated on time. Blockchain is going to facilitate accurate payment to the provider and improve cash flow speeds at lower costs. Now, often at the moment, simply because of lack of choice, it is really, really hard to find a good doctor. And if you end up with someone treating you that isn't really qualified, you might not have a choice. But the fact that you're able to rate and rank medical professionals might just put an end to that. If you think about how complicated insurance billing is at the moment, blockchain can clearly be used to speed up that process. Blockchain can facilitate immediate fund transfer, provide real-time eligibility functionality. Now we get onto record keeping, which I think is a tremendously good use of blockchain technology. All healthcare organizations have got massive record keeping requirements, and these often rely heavily on paper, and bits of paper frequently get lost. And Well aims to simplify record creation and data storage on a decentralized, anonymized blockchain network. And as we know, these are harder to hack and less susceptible to loss. Another point is that by nature of the many different professionals, organizations, and agencies we have involved with healthcare, healthcare can be really fragmented at times, from insurance company to patient to clinician. And Well aims to eliminate these points of potential breakdown, again, by using blockchain. Smart contracts look to ensure that transactions take place smoothly, quickly, and effectively, and that reliable records of all transactions are kept automatically. And this is going to help deal with another problem, which is fraud. I mean, the US Justice... That's a tongue twister. The US Justice Department estimated last year $900 million to fraudulent billing last year. Not last year, sorry, 2016. Well, however, requires proof of work, time and location stamping of actual care records, and undisputed hash records of all the steps of in a patient's service from start to finish, from referral to billing, and that should cut fraud right out. In a country where there aren't many medical professionals available, who's to stop someone setting up as a doctor and charging people money for their services? But the fact the Well network records everything should mean that legitimate providers' reputations increase. And hopefully the risk of a negative review should motivate all parties to remain honest, patients and doctors. Right, onto the challenges that Well face so far. Now, at the moment, they don't have any relevant partnerships, although they do have several clients, Matrix, Optum, and Century Pacific Medical Incorporated. And Optum generated $83 of revenue alone in 2016 and served 124,000 people. So they're a big player. Although they don't have any partnerships yet, in 2019, next year, they are planning on partnering with government medical agencies, for example, Estonia's. And they're going to try and form partnerships with Japan, Korea, and China. Although there are several other healthcare related crypto projects out there, none of them have a viable business model like Well does. And to conclude, Well focuses on a direct connectivity tool between patients and providers globally, which eventually will provide solution for many of the problems that other projects haven't been able to successfully solve yet. That's why I think it's interesting. Over to Crypto Chap for a look at CoinMarketCap. Ah yes, still there. Thanks very much for watching. This is Crypto Chap's Butler, signing off.